subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors Today. We are delighted to have here with us and welcome for the third time on our Health Live sessions, Dr. Rajiva Gupta. Dr. Gupta, let me introduce you first. But before that, I must give you a special reason why we have him here today. Can I ask to show us a screen of the latest issue of Seniors Today? Now, those of you who have seen the latest issue of Seniors Today would have seen our cover. It is a special story on managing fatigue, and which is written by Dr. Gupta. If you haven't seen it yet, please go to the Seniors Today website. That is www.seniorstoday.in. We'll also put up the link on the chat window. And so let me come back to Dr. Gupta. Dr. Gupta is a senior consultant in internal medicine and diabetes with an experience spanning over 40 years. He did his MBBS from the Maulana Azad Medical College, New Delhi, and MD from the Ram Manohar Lohia Hospital, New Delhi, now called PGIMER. He has also done a postgraduate diploma in diabetology from the St. John Hopkins University School of Medicine in the US and a special certificate course from the International School of Diabetes. He currently has a consulting practice at his personal clinic, Upahar Wellness in Gurugram, and is attached to the CK Birla hospitals at Gurugram and Punjabi Bagh in Delhi. He has been practicing earlier at his clinic in Ashok Vihar and affiliated with major hospitals like the Fortis Hospital, Max Super Speciality, Delhi Heart and Lung Institute in New Delhi. He has several accomplishments to his credit. He has, as I mentioned, he has written this book. He's written the article in our latest issue, but he's also written two books. One on stress and diabetes, which is the underappreciated connection, and this was published in 2023. And more recently, he has published a book on fatigue. And I'm going to request him to show us a copy of the book here. Yeah, so this was released as recently as March, and we are delighted that we are going to talk about fatigue today. Thank you, Doctor. And I'm going to also make an announcement now. So the topic that we've invited him to speak about is fatigue in seniors, causes, solutions, and the path to vitality. And as a special offer, special bonus to our audience here today, the top 10 questions, which will be decided by Dr. Gupta and myself, will get a copy of the book. We'll get a free copy of the book delivered within a week and a half. And how you will do it, etc. How will we get your address? We'll tell you later. To those of you who are going to be winning the book. So please stay on. Today's session may be slightly longer than normal, but without any further ado, I'm going to invite Dr. Gupta to talk about on the topic fatigue in seniors, causes, solutions, and the path to vitality. Over to you, Dr. Gupta.
Thank you, Prathiman, for such a wonderful introduction. And good evening, everyone. I'm delighted to be here today to discuss a topic that affects many of us, fatigue in seniors. So we keep on getting questions in our clinic that, doctor, I'm just tired all the time. Is that just aging? That's a question many of us have. But the good news is that fatigue isn't inevitable. So I'll just go through this Sanskrit proverb. Arogyam paramam bhagyam swasthyam sarva sadhanam. Now, good health is the greatest blessing, and wellness is the means to achieve everything. So health is just not absence of disease. It's a complete presence of well-being in terms of physical health, mental health, emotional and spiritual health. So we all know that as we age, recovery slows, sleep becomes lighter, and endurance declines. Many of us assume that fatigue is an unavoidable part of aging, but this is more of a myth. More often, fatigue stems from factors like stress, poor sleep, nutritional deficiencies, or chronic conditions such as diabetes, thyroid disorders, hypertension, or heart disease, etc. However, the good news is that we can regain energy and vitality by first identifying the root causes, staying active, and balancing rest with movement. Remember that age is just a number, but well being is a choice. Small lifestyle adjustments can make a big difference, helping us feel more energetic and improving the quality of life at any stage of our lives. After all, true health isn't just about living longer, not about the quantity or the duration of our life, but also about the quality of our life. And it's about living better. So today we will explore why fatigue occurs in seniors, its impact on daily life, and effective strategies to manage and overcome it. To bring these aspects, we'll begin with a case study of an elderly lady struggling with persistent fatigue. Through the journey, we'll uncover the challenges she faced and the transformative effects of targeted interventions. This case will serve as a foundation for understanding fatigue in seniors, setting the stage for a deeper exploration of its causes, effects, and management strategies. So the case study is the story of Mrs. M.K. Mrs. M.K. is a 68 years old retired school teacher. She has always been an active and independent woman. She loves gardening, enjoys reading, and cherishes her time with family. But something has happened over the last year. She found herself constantly exhausted, struggling to get through the day and losing interest in the things which she loved once. She is struggling with fatigue. So initially she dismissed her feelings as a part of aging. However, it soon became more than just feeling tired. She found it difficult to concentrate, had frequent headaches, and often felt breathless after a minimal activity. Even after a full night's sleep, she woke up feeling unrested. This began to impact her mental and emotional well-being, making her feel irritable and withdrawal. She would say, I wake up tired even after 8 hours of sleep. I feel drained by noon and need multiple naps. Simple tasks like cooking or walking just leave me exhausted. I don't enjoy things the way I used to. This is fatigue. No, but what is fatigue? How do we define it? Fatigue is a persistent state of exhaustion that affects the body, mind, and emotions, leading to reduced energy, motivation, and concentration. Fatigues has been classified into three types: the physical fatigue, which where we feel weakness, sluggishness, and reduced stamina. Then mental fatigue, difficulty in concentration, forgetfulness, and mental fog. Mental fog means which we call as a cognitive impairment, that we are not able to think clearly, or our thoughts become clouded. Emotional fatigue is when we start feeling sad or irritable, demotivated, and emotionally drained. Fatigue in seniors is a common but yet overlooked cause. Fatigue is a widespread issue among seniors, often overlooked because it is considered as a normal part of aging. But statistics show that there is a very high prevalence of fatigue. Almost 40 to 60% of elderly people experience fatigue, and fatigue increases with age, estimated to be at around 29% at age 70, increasing to 68% at age 85. The key risk factors. So I try to find out as to are there different risk factors in India versus the other countries. So globally, chronic diseases, as we mentioned earlier, cardiac disease, thyroid, heart problems, diabetes, etc. Poor sleep, inactivity, psychosocial issues. They are the most common causes of fatigue globally. In India, there are specific factors like malnutrition, anemia, neglect of the elderly, and poor healthcare access. So the developed nations benefit from better healthcare and early diagnosis, while in India, fatigue is more prevalent due to undiagnosed conditions because of restricted access to healthcare, malnutrition, and limited geriatric care. Plus, socioeconomic disparities and unaddressed mental health issues further contribute to the burden, because disparities are there. We may be living in big metros where healthcare facilities are very easily available, but the same may not be true of somebody living remotely in the country. Mental health issues as such many times they are taken as stigma and they are not addressed. Having defined fatigue and the prevalence, now we come on to the common causes of fatigue in seniors. So fatigue in older adults is usually multifactorial, resulting from a combination of medical conditions, lifestyle factors, and psychological issues. Medical issues, chronic illnesses, and physiological changes that come with aging. Anemia. Here, the low red blood cell count reduces the oxygen supply to tissues, leading to weakness. Chronic diseases like diabetes, heart disease, kidney disease, lung disease, and cancer, due to different mechanisms, they cause fatigue and tiredness. Hypothyroidism or even hyperthyroidism. An underactive thyroid slows the metabolism, leading to tiredness, and hyperthyroidism, in fact, accelerates the metabolism to a unduly disproportionately degree, and therefrom it causes fatigue. Nutritional deficiencies like low levels of vitamin B12, iron, and vitamin D. Sleep disorders like insomnia, inability to sleep. Sleep apnea, where there is interrupted breathing, and many times the breathing stops, and there is reduced oxygen supply to the brain and the muscles, and the person gets fatigued. Restless leg syndrome is another specific entity where, because of certain deficiencies, the person is very restless, and this disrupts sleep and can lead to fatigue. Pain related conditions, for example, arthritis, which is very common in the seniors, the osteoarthritis of the knees or the hip. Fibromyalgia, which is the presence of a diffuse pain all over the body and different parts of the body, and any other chronic pain condition, maybe disc disease or anything. Infection like chronic infection like tuberculosis. Medication is another important factor for fatigue in the elderly, which often we don't realize, and we find that senior people are given many medications. In fact, if you recall, I had given a talk on the medication overload in the elderly on the same platform. Medicines like antihypertensive agents, antidepressants, sedatives, anti-allergic medications, which are called antihistamines, they have got side effects and they also cause fatigue. Lifestyle factors are also one of the important causes of fatigue. Inactivity. Lack of regular physical activity leads to muscle deconditioning, making even simple tasks exhausting. So it's a contrarian theory that if you feel fatigued, then you should take rest. No, because if you take more rest, the muscles go out of use, and which is called deconditioning and making fatigue even more pronounced. Poor diet, imbalanced nutrition, skipping meals, or excessive sugar intake can cause energy crashes. Like sugar may give you an energy for a very short time, but then there is a crash. Dehydration. Elderly people often drink less water, and they do not realize it, and leading to low energy levels. Excessive caffeine or alcohol. While caffeine may give a temporary boost, it can also cause energy crashes, and alcohol also causes lethargy if taken in excessive amounts. Then the psychological causes also play a very important role. Emotional well-being plays a key role in energy levels. Depression, often underdiagnosed in seniors, depression can lead to persistent tiredness. In fact, it is said that depression often manifests as fatigue rather than sadness many times. Anxiety and stress, chronic worry can lead to exhaustion because the entire energy is depleted by constant worry and anxiety. Loneliness and social isolation. Reduced social interaction can contribute to emotional fatigue. Cognitive decline, dementia, and mild cognitive impairment can also be mentally exhausting for seniors and their caregivers. Chronic fatigue syndrome is a specific entity wherein there is fatigue which is not relieved by, it lasts for 6 months or more, and often accompanied by sleep disturbances, memory issues, and body pain. By understanding and addressing the common causes, seniors can take proactive steps towards maintaining their energy levels, enhancing their quality of life, and enduring long-term well-being. So now we have discussed about the definition of fatigue, the prevalence of fatigue, the causes of fatigue. How does fatigue impact our daily life? So fatigue reduces mobility and independence. It decreases physical strength and stamina. It makes daily tasks like walking, climbing stairs, and self-care more difficult. Leads to increased dependence on caregivers or family members. Then the fallout is an increased risk of falls and injuries because of impairment of the balance, coordination, and reflexes, making tripping, slipping, or losing balance more likely. And this in turn increases the risk of serious injuries, potential hospitalization, and a loss of confidence. After this happens, they can further reduce mobility, elevate the fall risk, and contribute to overall health decline. So it's not something which can be addressed in such a lighter way. And one can see the far-reaching influences on our daily life as well as on our long-term health, which fatigue has if it is not addressed. Fatigue also leads to weakened immunity. Chronic exhaustion compromises the immune system, increasing the infection risk. In the mental health effects, it is linked to cognitive decline, memory loss, poor concentration, increases the risk of mood disorders like anxiety and depression, and affects motivation and decision-making abilities. Then the effect on social and withdrawal and the reduced quality of life. Fatigue makes social interactions exhausting, leads to withdrawal from family, friends, and community activities. If somebody is always tired, and if a family member says who would withdraw from such occasions and may remain confined to home. So overall, this is at the cost of reduced overall happiness, engagement, and the sense of purpose. So it's a vicious cycle. Fatigue leads on to all these consequences, and these consequences further amplify the feeling of fatigue. So when to consult a doctor? Fatigue is not something we have to live with. Identifying and addressing the underlying cause, whether medical, nutritional, or lifestyle related, can significantly improve energy levels. And one should seek medical attention if we experience persistent fatigue that does not improve with rest. Unexplained weight changes, whether loss or gain, shortness of breath or chest discomfort, frequent dizziness or fainting spells, chronic pain which interferes with our daily life, sleep disturbances which affect energy levels, memory issues or confusion, depression or anxiety which impacts the well-being. So these are the what can call the red flags. One, we should think that these have to be addressed. So this is what Mrs. MK, our case study, in the case study, she thought that she would consult a doctor. And when she finally consulted her doctor, detailed assessment was done. Several factors contributing to her life, to her fatigue were identified. So there were medical conditions, mild anemia, low iron levels, so iron deficiency anemia, poorly managed diabetes, which led to fluctuating energy levels, vitamin D deficiency, then lifestyle factors, irregular eating habits, skipping meals, low water intake, lack of structured physical activity, psychological factors, mild depression due to social isolation because her children were living abroad. So this is a very common scenario which seniors often face. And sleep disturbances from excessive daytime napping, because she said that in the morning she feels very tired and not rested, and she's trying to compensate it by daytime naps. So how to go about it? Managing and preventing fatigue. So there are medical and lifestyle solutions. So there are 4 aspects to combat fatigue effectively. We focus on 5 essential areas: the medical management, identifying and addressing underlying health issues, nutrition and hydration, providing the body with the right fuel for energy, physical activity, keeping the body active and mobile, sleep improvement, enhancing sleep quality for better recovery, stress and social engagement, maintaining mental and emotional well-being. So we come to the medical aspects of fatigue in seniors. Preventive screenings. Preventive health screenings play a crucial role in detecting age-related health risks early, allowing timely intervention and treatment. Regular medical checkups help us identify underlying conditions that may contribute to fatigue, such as diabetes, thyroid disorders, hypertension, anemia, heart disease, cancer, and osteoporosis, which per se will not cause fatigue, but then it increases the risk of fractures if somebody falls. Early detection of underlying medical conditions. Fatigue is not just a part of aging. It can be a symptom of an underlying medical issues, which we had enumerated earlier, such as diabetes, thyroid disorders, anemia, and heart disease. Early detection through regular checkups, medical checkups, can help address these conditions before they worsen. In fact, if you take diabetes, the most common symptom with patients who are recently detected with diabetes is fatigue or maybe pain in the limbs. Then monitoring and managing chronic diseases. For those diagnosed with long-term conditions, regular monitoring and proper management are key to the timely medical consultations. Adherence to prescribed treatments and lifestyle adjustments can help control symptoms and improve energy levels. Medication review. Some medication can cause drowsiness or fatigue as a side effect. If you have been feeling unusually tired, talk to the doctor about a possible medication review. Adjusting doses or switching to alternative treatments may help alleviate fatigue without compromising the treatment. Vaccinations and necessary medical interventions. Staying updated with flu shots, pneumonia vaccines, and other necessary immunizations helps prevent infections that could sap the energy. Proper medical care, including timely interventions like physical therapy or hormonal replacement, when needed, can also play a role. So next comes nutrition and hydration. Now, they are the fuel for energy. Nutrition and proper hydration play a crucial role in maintaining levels and preventing fatigue. Let's look at some key aspects of our diet that supports sustained energy. Number one is a balanced diet. The food we eat acts as a fuel for our body. A well-balanced diet with the right mix of macro and micronutrients is essential for maintaining energy levels throughout the day. We should focus on proteins from sources like lean meat, fish, eggs, dairy, legumes, and nuts. They help with muscle repair and endurance. Healthy fats from nuts, seeds, and olive oil. These support brain function and keep energy levels stable because they are the sources of omega-3 fatty acids as well. Complex carbohydrates such as whole grains, fruits, and vegetables, they provide a slow and steady release of energy, unlike refined carbs that lead to sudden crashes. Key vitamins and minerals. Certain nutrients are vital for energy production, and a deficiency in any one of these can contribute to fatigue. Iron prevents anemia, which can cause exhaustion. B vitamins, especially B12 and B6, help with the energy metabolism. Magnesium plays a role in muscle function. And vitamin D, low levels can lead to fatigue and muscle weakness. So sunlight exposure and dietary sources or supplements help to maintain good levels. Hydration, as I mentioned earlier, is very important because many people don't realize that even mild dehydration can cause fatigue. And in fact, once the summers start approaching, the temperature starts rising, suddenly we find that there's a surge in people complaining of fatigue. And that is because they started going into dehydration, and the optimum amount of water intake is not there. A simple way to stay energized is to drink at least 8 to 12 glasses of water per day. And if the person is physically very active or in a hot climate, the amount may be more. Herbal teas, coconut water, and hydrating fruits like watermelon and oranges also contribute to fluid intake. About caffeine and sugar moderation, while coffee, tea, and sugary snacks may give a quick energy boost, they can also lead to sudden crashes later. Instead, choose foods that provide a steady energy release, such as nuts, yogurt, and whole grains. If we take caffeine, try to limit it to morning hours only and avoid excessive intake, as it can disrupt sleep pattern, leading to fatigue the next day. So by focusing on a well-balanced diet, ensuring hydration, making mindful choices about caffeine and sugar, we can significantly improve our energy levels and improve our well-being. So exercise and movement boosting energy. Many people think that resting more will help overcome fatigue. But in reality, too much of rest can make fatigue worse. The key to sustaining energy levels is staying active. Simple, low-impact activities like walking, stretching, light strength training can make a big difference. Yoga not only enhances flexibility and circulation, but also promotes relaxation. Additionally, avoiding prolonged sitting and incorporating gentle movement throughout the day can help keep energy levels steady. Let's explore how movement can be a powerful tool in combating fatigue. Simple exercise like walking, one of the easiest and most effective ways to stay active, improves circulation, strengthens the heart, and enhances mood, which is also called cardio. Even 10 to 15 minutes walking can help digestion and increase energy levels. Stretching helps maintain flexibility and reduce stiffness. Can be done while seated or standing. Focus on gentle neck, shoulder, and back stretches. Light strength training, using light weights or resistance bands, can strengthen muscles, prevents age-related muscle loss, and improves posture. Yoga enhances flexibility, balance, and relaxation. Simple chair yoga poses uh, help flexibility and relaxation and balance. And there are a lot of programs which go on the internet nowadays. People must have seen. Importance of daily mobility: avoid prolonged sitting, move every 30 to 45 minutes. So this is what I tell to the people who are working, they say working from home, younger people. But then it is important because fatigue is not only an issue with the elderly, it is as common in the younger people in their 30s, 40s, or 50s. Incorporate small movements throughout the day, gentle stretches while watching TV, standing and moving while talking on the phone, light household activities like gardening or walking inside the house. So there is a saying called motion is lotion. Movement keeps the joints lubricated and prevents stiffness. Then we come to sleep hygiene. So most important is the quality takes precedence over the quantity. Many people focus on getting enough hours of sleep, but the real key is quality sleep. A well-rested mind, body depends upon a good sleep hygiene, which means developing healthy habits that promote sleep, and it's a deep, restful sleep. It is important to establish a routine. Going to bed and waking up at the same time daily improves sleep quality, even in the weekends, because it helps regulate body's internal clock. This consistency makes it easier to fall asleep and wake up feel refreshed. Another is limiting screen time before bed. The blue light from the devices disrupts the melatonin production and interferes with the sleep. To improve sleep quality, it's best to turn off the electronic devices at least 30 to 60 minutes before bedtime. Relaxation techniques. Engaging in calming activities such as meditation, deep breathing, or reading a book can help to signal to your body that it's time to wind down. Avoiding activities that keep our mind active, like scrolling through social media or watching intense shows. Making a comfortable sleeping environment. A cool, dark, and quiet room enhances sleep. Using blackout curtains, keeping temperature comfortable, reducing noise distraction can help create an ideal sleep space. And a good mattress and pillows also make a significant difference. So prioritizing sleep quality over quantity, we can wake up feeling more refreshed, energized, and ready to take up the whole day. Small adjustments to our nightly routine can lead to big improvements in overall health and well-being. Now, mental and social well-being, managing stress and staying engaged. As we grow older, mental and social well-being play a crucial role in maintaining overall health and energy levels. Managing stress and in staying engaged with life can make a significant difference in how we feel every day. Let's start with stress management. Stress is the natural part of life, but chronic stress drains our energy and affects our health. Simple practices like mindfulness, internalization, meditation, and deep breathing exercises can help us stay calm and focused. Just a few minutes of deep breathing can reduce stress, lower blood pressure, and improve mental clarity. And here I would like to mention a practical instance that people come to me with their blood pressures, and I ask them to monitor their blood pressure at home, and I tell them specific instructions. Make the person lie down comfortably, whosoever is checking the blood pressure. Ask the person whose blood pressure is to be taken to take a deep breath, take a reading, wait for about 1 to 1.5 minutes, again take a deep breath, and you will invariably find that the second reading is lower than the first reading. Because those stressful hormones, they have got diluted over that, say, 1.5 minutes by deep breathing, and the blood pressure is lower. So if such a practice is continued multiple times a day, obviously there will be a sustained reduction in the blood pressure. I mean, I don't want to say that the person may be able to get off the medicines, but definitely the requirement of medicines might decrease. The another key aspect of mental well-being is social connections. Engaging with family and friends is not just enjoyable; it is essential. Loneliness and isolation can lead to anxiety, depression, and even physical health problems. So actually, anxiety, depression, they are never isolated. Sooner or later, they are definitely going to create physical health issues as well. Whether it's regular phone calls, video chats, or meeting in a person, staying socially connected boosts our mental energy and emotional resilience. Beyond socializing, it is important to have activities that bring us joys. Hobbies and interests give us a sense of purpose and mental stimulation. Whether it's reading, gardening, playing music, or learning something new, engaging in enjoyable activities keeps the brain active and enhances overall well-being. Now, again, here I like to give personal instance. Like I stay in Gurgaon, and it's a working population, migratory population. People come and work here. Their parents also get shifted here. The children are busy in their work, but the parents, they find it very difficult, especially who are coming from smaller cities. They find it difficult to adjust. कोई बात ही नहीं करता हमसे. So I said, I tell them, you go out in your apartment complex, walk, just smile at someone. At least if 10 people are there, out of 10, one person will definitely connect with you. But you have to be the first mover. And then there might be common interest. And even if that doesn't happen, at least you are talking, you're seeing people, you're getting happy. And somewhere you definitely find people. So you have to engage. Then find out what you like. There are places, the opportunities are umpteen everywhere, practically everywhere. So engage in those activities, engage in the hobbies. So that's very important for improving our mental and emotional health. Let's not forget the power of laughter and positivity. You must have heard of laughter clubs, laughter yoga. A good laugh releases endorphins, reduces stress hormones, and lifts our mood. Surrounding ourselves with positivity, whether through uplifting conversations, humor, or gratitude, helps maintain high energy levels and a healthier mindset. So, now coming back to our case, solutions implemented. Reducing fatigue isn't just about getting more sleep. Her doctor suggested a holistic approach. Diet and nutrition, increase protein intakes with eggs, lentils, and dairy, iron and multivitamins, more water intake. Physical activity, introduced a simple 30-minute morning walk routine, gentle yoga for flexibility and relaxation. Sleep hygiene, fixed a bedtime routine with no screen time an hour before bed, reduction of afternoon naps to 30 minutes max. Mental and social well-being, she was an educated lady, joined a local reading club for social interaction, started meditation for stress relief. And the outcome was a positive transformation. 3 months later, she felt like a new person. Her energy levels improved. She felt more engaged in daily activities. And most importantly, she regained her enthusiasm for life. She still experiences occasional fatigue, but she now understands how to manage it better. So the key takeaways are: prioritize quality sleep, stay hydrated, nourish your body, keep moving, manage stress, and stay engaged, limit caffeine and sugar, take breaks and get sunlight, stay proactive. Regular health checkups help detect underlying medical causes of fatigue. Listen to your body. Seek medical evaluation if fatigue persists. Fatigue is your body's way of saying it's time for a change. Living an energized life is possible at any age with the right balance of health, mindset, and daily habits. So tonight, let's take a moment to reflect. What small step can you take tomorrow to boost our energy? A refreshing walk, drinking more water, or prioritizing better sleep. Every positive change brings us closer to a healthier, more vibrant us. Start today, take that first step towards better energy and have an active future. It's not necessary to get overwhelmed. Just take one step at a time and the results will be there. Thank you.
Thank you very much, Doctor. Amazing presentation and very detailed. We have quite a few questions that have come in. And I'm going to start with the first one, Doctor. This is from Mr. D.K. Bharadwaj, who asked, does depression also add to fatigue to an individual irrespective of the age?
Yes, definitely, because as you mentioned, psychosocial factors, psychological factors, one of the very common causes is depression, because again, fatigue and depression, they've got a bi-directional relationship. A person who is depressed will not be motivated to participate in the normal activities which forestall or which prevent happening the occurrence of fatigue. Now he doesn't do that, so it lands up into a vicious cycle. He doesn't act. He doesn't take interest in walking. Doesn't feel like walking, and the sleep pattern gets disturbed. So all of them, they cause further depletion of energy. Depletion of energy leads on to fatigue. So it's a bidirectional thing.
So similarly, like Shada Parvai has also asked about anxiety. That can also add to fatigue, right?
So anxiety is the thing which actually, anxiety is a heightened state of alertness, awareness. So it depletes our energy. And because of anxiety, anxiety means that there is undue apprehension of something which is bad about to happen, which actually doesn't happen. This element of fear is there. So our energies are focused not towards the healthful activities, but they're focused upon those things. So energy is limited, finite. So that energy gets depleted and the person starts feeling fatigue.
Right. Doctor, there's a question which is coming from Mr. D.K. Bharadwaj. Now, I know it's not a thing around Okay, let me ask you a question from Sunita Verma. I'm just sticking to fatigue questions. Can an active person experience fatigue too? Sunita Verma asks.
Yeah, see fatigue now in the book which I have written. So I have divided fatigue into acute and chronic fatigue. So acute fatigue is something which lasts say less than about 3 weeks, and acute fatigue is usually either due to it's a temporary thing. It may be either due to an acute illness. Somebody has got a viral infection, for example. Then, as a part of the viral infection, or sometime late till subsequent few weeks, the person may have fatigue, but then it goes away. Or somebody has got some timeline, something very urgent to be done that causes mental fatigue. But then once that situation is over, it goes away. So even active persons can have fatigue. But then if the same active person, if the fatigue is persistent, then probably something else has developed, has crept into. Then we need to take cognizance of that.
Right. We have a question from Saroj, who asks, do you think skipping the regular exercises for a few days could be a reason for muscular pain and fatigue?
Yes, definitely. Because it is said that even just 48 hours of absence from exercises, it causes the muscles to decondition. See, what is the role of muscles? Muscles have to contract. And if they are not used, then they become sluggish and then become stiff, and it can give rise to fatigue.
We have a question from Anita J, who asks, how do you measure body fatigue?
See, now, so there are, if you can just simply say, take a scale of 0 to 10. Now, maybe you say that 0 to 3 is mild, 4 to 6 is moderate, and 7 to 10 is profound or severe fatigue. So it's very subjective, it's a scale, because fatigue is finally one's own perception. मैं थक जाता हूँ, मुझसे काम नहीं होता, मुझसे कमजोरी आ गई है बहुत ज़्यादा. Subjective है ना ये तो. This is how the one person feels. So there is no yardstick for that, but it's all individual perception. So when a person comes to me, doctor, I'm feeling very tired. Okay, how would you rate it? So most of them, because see, and one can make out also, so mild to moderate types is more common.
Doctor, you've touched upon various factors, but there's a question from Hina Mehta who says, is high BP also a cause of fatigue?
No, high BP per se will not cause fatigue unless, see, now a person who has got high blood pressure and he or she complains of fatigue. So we have to see, most likely I would assume that either there is a side effect of the drugs. Now many people with on antihypertensive therapy, they take diuretics, which cause release of salt from the sodium from the urine, like chlorthalidone or indapamide, etc. So electrolyte imbalances can take place. Some of them cause low potassium levels. That can cause fatigue. And there are certain agents called beta blockers. They also cause fatigue. So one is medication related. Or if the persistent hypertension, it causes some further complication within the person, be it a cardiac complication or a renal complication. So per se, early hypertension without any other end organ damage or any other thing, it doesn't cause fatigue.
Right. We have another question that is there from Bomi, who asks, Doctor, does low level of B12 and menopause cause fatigue in seniors?
Yeah, see, low levels of vitamin B12 definitely, because vitamin B12 has got many influences on energy metabolism, so that causes fatigue and one of the very common causes of fatigue. And menopause again, menopause is the time when there are a lot of emotional issues also going along. Many physiological changes are there, cardiovascular changes are there. So all of them in totality, the chances of fatigue become higher. But then the treatment is to let that fatigue not get deep rooted. The moment you find that you are fatigued, you get yourself checked up, for a preventive health checkup, as I had mentioned in that slide. Find out if there is any contributory cause for your fatigue, and start engaging yourself in healthy habits to take care of that.
Right.
See, nowadays you find people, there is no age bar for gyms. People at any age, they go to gyms and do Zumbas and things like that.
Right. Doctor, there's an interesting question that has come in. This is from VG Ganduri, who asked, generally doctors say fatigue is common in the elderly. At the most, a multivitamin is prescribed for some time. Which medical specialization, as in what kind of a doctor do you go to for if you have fatigue? Do you go to a general physician? Do you go to a cardiac? Who do you go to?
Fatigue is always multifactorial. Multifactorial means there are many factors which are operating. So you cannot say somebody has got a low vitamin D, entirely vitamin D deficiency is the cause, because 9 out of 10 people in India have got low vitamin D. Doesn't mean that everybody is getting fatigued. So so the best person would be to go to a physician, internal medicine, general physician. He would see the person holistically, get relevant tests done, take a detailed history, and do the tests, and then interrogate as to what all factors could be operative in that. Now, giving a multivitamin as a magic pill, that's a very short-sighted view. That is not right, because who knows, a person who is having an elderly person who has had suppose an angioplasty or a bypass surgery 10 years back, and now he starts complaining of fatigue. We would first consider, is it related with worsening of his underlying cardiac condition? Because as we age, the clinical presentation of the illnesses becomes very subtle. And practically, fatigue is one of the presentations for many of the illnesses. So that's why I said, whether it is cardiac or diabetes or thyroid or kidney problem or liver problem, so they all manifest as fatigue in the elderly. It is not that a cardiac patient will start complaining of chest pain, not necessary.
And we have a question from Geeta Radhakrishnan. It's concerning fatigue, it's concerning sleep. For sugar patients, taking a sleeping pill, is it necessary to get proper sleep?
See, I would personally, discourage that, but then we have to find out if insomnia is there. Like I said, that we should first try those methods, turning off, relaxation, and sleeping routine. That is more important, and it is not something to do with diabetes as such. And if that doesn't work out, then probably there will be some underlying reason, chronic anxiety state or subconscious stress, and probably need some counseling therapy or psychiatrist. That depends. It depends upon an individual. But definitely, if you stick to routine and switch off, try to wind down, that should help.
Right. We have a question from Manju Sinapati. How do you distinguish between normal fatigue and versus fatigue due to different illnesses? Because first few steps that you take will depend on the underlying causes of fatigue.
So the normal fatigue or normal tiredness, what we call it, usually decreases with rest. It is short lasting, maybe 15-20 days. And there may be an acute precipitant, for example, a recent viral infection, or maybe a recent stressor, or a recent travel. Somebody goes on a trekking or something and he comes back fatigued. So that improves with rest. Whereas the fatigue due to illnesses, now illnesses could mean both physical as well as psychological or even lifestyle issues, that usually doesn't go with rest. So this is a very important distinction to distinguish that in the night you get up in the morning, you have had a night's sleep, still you don't feel energized.
Thank you very much, Doctor, for an amazing presentation. We've got quite a few questions in already, but there are over 200 participants right now live, and there are many more on YouTube. I'm not going to be able to take all the questions. I have stuck to fatigue, and I've also looked at some of the interesting questions so that it is representative and we are able to select the top 10. So we will end the session now, Doctor, and I will just go through some of the interesting, people who I think were good questions. So 10 of them I have made a note of. One is Mr. D.K. Bharadwaj. He asked a question, depression. Sharda Parwale, who asked on anxiety. Sunita Verma, Saroj, Anita Ji, Hina Mehta, Bomi, Vijay Ganduri, Geeta Radhakrishnan, and Manju Senapati. Manju Senapati was the last question about normal versus. So all of you here whose names I have taken just now, what you need to do is you need to send us your address, because we haven't taken your address send it to us at seniorstoday.in. I have put the email address over here. Kindly send us your name, address, PIN code, and mobile number. Okay, you can send it to us by email, or you can send it to us by phone number. Yeah, by on phone, which Firoz, where is the number? Can you put it again? Firoz, can you put the number again?
Yes, sir, I'm just posting it.
So please send us your address. I'll just repeat the names. DK Bharadwaj, Shada Parvare, Sunita Verma, Saroj, Anita, Hina Mehta, Bhomi, Vijay Ganduri, Geeta Radhakrishnan, and Manju Senapati. You all are the winners of the book. I'm going to ask Doctor to show the book again to everybody. So we will, what we will do is we will send you the book by courier or by Amazon, whatever. We'll see whatever you can reach fast. Once again, let me just repeat. Either you can send it as events@seniortoday.in, or you can send your name, address, PIN code, and mobile to 96996-90728. I'll repeat, 96996-90728. Send us your details, and we will send you a copy of the book within a week. It'll reach you within a week and a half. There are a couple of holidays coming up, so we may get delayed because of that. And that's how it is. Once again, thank you very much, Dr. Gupta, for being here for a detailed presentation. Yes, Dr. Gupta.
Yeah, so you said that many questions are left unanswered. So there is a possibility if the people can send to you on mail and you can forward them to me. I'm ready to, there is no problem for me. I'll write just one or two line answers and we can.
Actually, what I've done is we'll take a copy of the questions. But many of the questions are not concerning fatigue directly, but I will send you the questions any which way, just for you to get a flavor of the questions. Yeah. Thank you once again, Dr. Gupta, for an amazing presentation. Thank you for writing the article for Seniors Today magazine. Those of you who haven't read it, please go through the magazine, which is the March 15th issue. It's there on the website, seniorstoday.in. You can have a look at the article until and those of you who have not won a prize, please go ahead, go to Amazon.com and buy a copy. It is worthwhile. It is good reading. I have read it myself, and I have known Dr. Gupta for some years. He's been on our sessions twice earlier, so it was an amazing session. Thank you once again, Dr. Gupta, for coming here, for taking a time off on a Saturday evening. And
yeah, I always love this because I practice what I mentioned in one of the slides. Keep yourself engaged. Do what you like, do what you love. So this is one of the things, talking with people, listening to them, observing them, sharing the insights with others. So this is a great pleasure and great satisfaction to me.
Thank you very much, Doctor. And to all of you here, wish you an amazing festive season. We have a few festivals tomorrow. There's Gudi Padwa in Maharashtra. There's Ugadi in Karnataka and Andhra. There's Cheti Chand. And of course, there's Eid as well. So those of you who are observing all these festivals, please have a great time. Enjoy yourself. And we will meet you next week. That is April 5th for another session of Health Live at Seniors Today. Thank you very much.
Subscribe now and press the bell icon. Never miss an update.